Welcome to the Executive Innovation Show podcast, where we bring you real executive conversations with industry game changers and thought leaders. We ask the questions you're thinking, what you're scared to ask, and we make your brain hurt afterward. With your host, Carrie Chitsey Wells, co-founder and CEO of One Touch Video Chat, live video interviews, and the nonprofit Humans Helping Humans.
Hello, everybody, and welcome to this week's episode of the Knowledge Knugget. Today's topic, we're going to be talking about telehealth in rural communities. We're going to talk about the successes and the complications in today's episode. So first, I want to talk about COVID has really shed a lot of light on providing telehealth to demographics that normally weren't being served via telehealth. A lot of your Medicaid and your Medicare population, as well as rural demographics that didn't have access to specialty medicine, that didn't have access to even emergency medicine without driving 30 or 40 miles. So what telehealth has really done for rural demographics is really save those patients drive time, travel time, some traveling an hour and a half to 2 hours just for a doctor's appointment. And so for routine visits, it's really saving a lot of convenience for those particular patients and providing better access to care, especially for our chronic care demographics that now have the ability to be able to use telehealth for oncology or nephrology or dermatology, anything in specialty medicine. Usually in rural demographics, there's a shortage area. The other topic I want to talk about is really the access to mental health. In rural demographics, mental health, there's a lot of issues of access. There's some psychiatrists that have, over 1 million population, and there's only 1 or 2 in the community. And so being able to provide mental health access in rural demographics is really on the telebehavioral side, a real big benefit for rural demographics. Same on the addiction and substance abuse side. Now, in regards to the complication side of things, you've probably seen on the news a lot of talks about bandwidth and being issues in rural demographics. That is an issue and a concern on the telehealth side. Even though in rural demographics, the home internet is not as big of a concern for Wi-Fi and things like that. There's still significantly less minimum speeds. But when you look at carrier networks and you look at cell phone towers in those rural demographics, now that you have people working from home, now that you have a lot of folks in demographics, kids out of school, things like that, the congestion on those cell phone towers really have hurt telehealth. Telehealth is not just about how much bandwidth you have. I know it's a lot of what you see in the news, but it's way more complicated than that. So when we break it down, you do have the bandwidth that is a concern. You need a 2 to 1.5 megs for telehealth to hold both sides. You have 2 video streams and 2 audio streams, and so to carry both of those sides, you really need 1.2 to 1.5. Then we start talking about the pixel and the resolution rate. So HD starts at 720 plus, that's still semi-HD, and you really need 1080. So when you break that down in rural demographics, sometimes, again, hitting that carrier tower, even from home Wi-Fi, if you have both spouses on internet, if you have kids playing video games, things like that, your resolution, even though you might have the latest and greatest iPhone with a great camera, your resolution goes down dramatically. So we are seeing in rural demographics 320, in some cases 180 coming from rural demographics. So that will cause less on your bit rate, which is the transmission back and forth of how much kind of up and down speed you have. And then you have the frame rate. So your frame rate, typically a great frame rate is 30. That's typically what you get on your television or a DVR, things like that. And so when that gets reduced too, it's really all of those that really affect rural demographics. Overall, we're paving a huge way on telehealth in rural communities. There's been so much successes, so much open up billable codes, really keeping patients safe, providing better access, and then really helping out caregivers that are taking their senior parents and having to take off work and drive them to all these appointments. So overall, the successes outweigh the complications. Just know if you're a provider in a rural demographic, you do have to be patient because you're going to have patients that are going to drop off because of bandwidth, and you might have to reconnect. But again, it's saving that 2 hour and 15-minute time for a 5-minute face with the provider. So if you are a provider in that area, hang in there. The successes outweigh the complications, but it will take you just a little bit more time. As always, please subscribe to the podcast and get your shows delivered in your inbox on Tuesdays and Thursdays. If you have a topic that you'd like us to address, please let us know. That concludes today's Knowledge Nugget, and we'll see you next week.
This podcast has come to a close. To hear more from the Executive Innovation Show podcast, subscribe, submit questions, and share the love. Follow us on social. We're everywhere.